And we're seeing it time and time again where we take over a group's plan and there's hidden fees that they don't know about.
Yeah.
That's
Share
not
an example from last year. What
that's
happened?
not just one. We started working with one here in Nashville last year, a large organization, and they have done a great job focusing on their plan. They've done a great job focusing on who's running the plan, who's being compensated, who are the pieces of the plan. But they didn't know that they'd switched PBM partners and then that the prior broker had built in compensation per member per month on that PBM plan. And that would be something that one, we would consider just from a transparency standpoint and not putting that and never sharing that with the employer. I mean, again, it goes back to we had the conversation about being transparent, being open, being honest with everything we're doing. That would be an example of somewhere where someone was hiding dollars from an employer that they were getting compensated. And it's clearly, again, created a conflict of interest between that advisor and the PBM they were recommending.
Mm-hmm.
Black and white. So again, if you're running an employer-sponsored healthcare plan, where are the dollars going outside of claims and your fixed costs? If you don't know that's a good place to just start asking questions and understanding that. And I mean, we should all be on the same page with what that is. And everyone in this space deserves to be compensated appropriately.
Yeah.
But there needs to be a conversation around it.
For sure. An example, we're working with a client. We're helping them transition to reference-based pricing. And we're getting a proposal from a few different partners. And two of them, they just get paid a flat per employee per month fee. The third, they have arguably the best technology and probably the best employee experience in the space, but they get paid a % of billed charges. So think about you go get care at the hospital system, or you're going to go get a knee surgery, outpatient care, and then that dollar amount that's billed is $50,000, and that vendor, they would take 20% of that, 10%. I don't know what the number is, but that for us, that creates a conflict of interest because then they're incentivized for this facilities to bill as high as possible so they can negotiate down as low as possible and make as much money as possible. I don't know, for our team, that doesn't align well with what we do. So we try our best to put partners in place that are paid a flat dollar transparent per employee per month fee. And their number one job is to serve the client rather than some type of other incentive outside of the client's viewpoint. This client, the proposal that we got, they're going to save 45% if they want to move forward on their claims dollars, which will be significant. It's a healthcare company in Nashville. And they've been in an unbundled self-funded ecosystem for 2 years right now. And they're ready to move down the productivity continuum. Their employees understand the program. They understand the partners in place. So they're ready to take that next step and go reference-based pricing because they understand the why and they understand the ROI of doing it. And they're willing to take that jump because the impact it's going to have on their employees and the business.
Yeah. Yeah. Again, it all goes back to there's a lot of decisions. I think there's a lot of options within the employer healthcare space right now. If someone said, hey, there's just no options, then I don't know what they're doing. I mean,
you were about to say something.
No, I just don't know what they're doing. I think, and I think we should all really be excited about where healthcare and benefits is going. Because it is really easy to see that change is happening drastically. And if you're with an advisor that executes and can execute, they can help navigate the options. And I wouldn't say it's easy. None of this stuff is easy to do, but it's possible. And the ones that, look at the space today and say, hey, there's opportunity to be innovative. There's opportunity to leverage new tools, new partners. We understand where our money's going. We understand why we're paying the claims we're paying. And we want to engage our employees around healthcare and benefits. Those are the ones that I think are winning